You're now live, Chair.
Okay. Can everyone just go on mute when they're not speaking, please, and we won't have any feedback. Thank you. So welcome everybody to the public section of the Rotherham Integrated Care Partnership Place Board. This is our monthly meeting. So just to go through the agenda, just in terms of public and patient questions, Lydia, when have we got any questions from the patients or public?
No, Chair, I'm not aware of any. Okay,
thank you. Obviously, if people do have questions, feel free to write into us and then we can formally respond to them as part of our agendas. So in terms of the agenda now, we've got some business items which we need to get some updates on. And we've got some transformation group updates. The first one is from children and young people about special educational needs and disabilities. And Nathan, I think you're going to take this item.
Yeah, I am, if that's all right. And Gordon has supportively offered to help with the presentation and the slides because I'm not as Zoom au fait.
Okay, thanks Nathan. And welcome, Nathan. And Gordon's just coming up on my screen now, Gordon. Nathan, is that okay? Can you see that?
Yeah, that's brilliant.
Okay.
Thank you, Chris. So good morning, everyone. My name's Nathan Heath. Thank you for inviting me. I'm the Assistant Director of Education and Inclusion for Rotherham Metropolitan Borough Council. I'm just giving an overview in relation to the SEND priority area, and in giving some context to that as well. It does sit within our joint written statement of action, which aligns to our Ofsted inspection, and there's quite a strong level of correlation as I go through the slides. So I will touch on that to make sure it sits against the priority area, but also in that wider context, the collaborative work we're doing across the system in relation to SEND. So Gordon, I feel empowered to do this. If you could move on to the next slide, that'd be brilliant. So just giving an overview, we're now collectively in a strong position in relation to our SEND strategic board and ultimately the formation of a SEND executive. There's a number of colleagues that are on this call this morning that are providing a strong level of support to both the executive and the strategic partnership board. That supportively has allowed a real strong hold of accountability on the first stages of our SEND improvement as we're moving through the written statement of action. Also, within the context of RMBC, that there's been a clear priority around education recovery as part of the council's work to support the key steps in relation to the COVID context and a level of recovery. Ultimately, in the most recent period, we've stepped back into a period of response, but now moved back into recovery. And as part of that work, we've worked with colleagues from public health to develop a team around the school pilot. That pilot runs now to the end of March and has already seen a number of success measures, very much focused around transitions and supporting mental health and well-being for those children that have had distinct impacts of the pandemic impacting on their education. We've supportively been allowed to extend that pilot a little bit, so a significant majority of Year 6 students across the borough will get that additional support in relation to access for mental health and well-being, and that's been well received across schools. Wider than that, we've got a significant piece of work around that graduated approach, both in Key Stage 1, so early years in primary, into that sort of junior stage of education and moving into Key Stage 3. And the sensory model is implemented and is a key area of the SEND toolkit, which is accessible across the system. I think as we go forward, that SEND toolkit, which has had a strong level of support from the designated clinical officer in development, will also continue to grow and become a real key facet in challenging and supporting some areas of the SEND system where we're getting less traction in understanding that there has to be a very clear response to SEN and disability right across the piece. And from the context of taking the key areas of the local area inspection, there's a strong level of understanding of the oversight of leaders that's informed the development of that executive board. And as we go forward, we've developed that joint commissioning arrangement to support some key steps. I think it's really appropriate to touch on that co-productive element. That was a real strength of our local area inspection and continues to be an absolute positive in the Rotherham system. That is a challenge. I don't want to go into the next slide quite yet, but there is a wider challenge we're seeing across the system in relation to that context where we've got co-production well embedded through our 4 cornerstones models, and from outside and external providers, that maturity of the Rotherham system is very different to some of the other SEND systems that they're working against. We've got a good level of knowledge and understanding from DFE and NHS England and improvement, but it's an area where we just need to continue to amplify the strong working relationships we've got. If you're happy to move to the next slide, Gordon, that'd be brilliant. We're giving an overview, and these are moving targets against that written statement of action that I've touched on. I think that strong work that we're doing to embed that toolkit needs to be right across the partnership. We're really pushing hard that is reflective of both education, health, children's social care, and other reciprocal providers within that space. I think that graduated approach is an area that has got particular focus from Ofsted and CQC, and actually there is a polarized position where we have some really strong practice in the borough, especially in some areas of health and also in education, but that's not a consistent approach. So we've taken a real strong line within the written statement of action, been very ambitious, very much a sharp focus around pushing that forward. I think rightly as transposed right across the piece in all those areas of SEND focus, it's really fundamentally essential that lived experience for both children, young people, young adults and families is defining the work. That engagement and co-production has been really supportive in developing that written statement of action. And as we move into the 4 key areas and looking at the action groups aligned to that, we've moved that forward into a space where parents and carers, wider partners are fully represented in each group that are driving the actions that ultimately feed that governance group I touched on. But it's an area that we can't stop on. It's an area that we've constantly got to check and measure to make sure that lived experience is informing what we're doing. The other areas, just to give some wider context, the quality of education at healthcare plans was an area of focus within the inspection and an area that defines our written statement of action. We're really pushing forward with some key plans in that space, but that's a gradual and supportive process to make sure that we're quality assuring and evidence in that, and both the SEND partnership board and the SEND executive to a wider extent are fully assured on that. Our next SEND executive group will focus on that area to make sure that the work is moving at pace, but also that it's collectively capturing that wider partnership overview. And one of the key areas immediately out of the back of the SEND inspection was that single commissioning model we had in place around SENDIAS. That was an area of concern that's been immediately addressed and supported. So we're now in a position where we have given notification to SENDIAS that from the immediate position at the next financial year it will be a jointly commissioned service, and I think that feels supportive of the context of demand and support that's provided around by SENDIAS advice services in the borough, and feels a collective way forward. I think that's been well received, and it's an area that we was able to discuss with the DFE and NHS England improvement, and they felt that was a real positive immediate step. I do recognise that in other areas that's a key area of challenge, and the wider one, which is a thematic area as we go forward in relation to that intelligence, but also performance and understanding how we shape services as we go forward, is that the JSNA having that very clear overview that touches on health and social care needs, as well as having a singular education focus in some areas. If you're happy to move to the next slide. So just to give overview, the written statement of action, the work we've done across the autumn term. That written statement action was submitted to Ofsted at the end of January. We had an expectation that we'd have some level of lag and delay from Ofsted while they work through that written statement of action, but actually that was immediately accepted with a number of areas of positive feedback provided by Ofsted. So we're now in a position that the written statement of action will be published on the local offer, and the 4 action groups that are driving the 4 areas as we go forward are moving through those key areas. To the wider place plan, the 2 key areas that we're really driving to have that traction and support to the system, and also make sure that it's reflective of the needs of our children, young people and young adults, is that quality of EHCP plans, the education healthcare plans, and making sure they have their full and wide contribution from health and social care partners, and also that graduated approach. I think the graduated approach feels an area where we was developing some strong work, and that toolkit that I've touched on, and that buy-in from right across the system for that feels like it's already got the right structure in place to drive that forward. I think there's key areas of education that need to support some of those areas of development, and as we go forward, there's a number of key actions that have been agreed. We continue to embed the 4 cornerstones approach in Rotherham, and our written statement of action was reflected of that. We made sure that it absolutely aligned to that process and the language and the utilisation, and it had a full overview from colleagues in that space, both feeding into it and also supporting as we look to submit. We're looking at developing a wider level of outreach support for some of our key areas of demand, and that is supportive of some key pressures in the system. So we will be in a position from September 2022 where we'll have social, emotional, mental health outreach support in the secondary phase of education, and I think there's a key element that directly links to the graduate response in both that space in relation to actually having a tiered approach that matches some of the strong work from mental health support teams in schools, and the extension of that pilot, some of the additional capacity and resourcing that's been placed in the system from the DFE. So it feels like as we move forward, we'll have a very holistic offer in Rotherham in that space, and that's a key area of demand. And the final one is to continue to audit the graduate response and the continuum of provision in line with the SEND Code of Practice. We are awaiting, as many people are, a national SEND review, which has been much vaulted by central government. That is likely to be in place with an education white paper at some point over the spring and summer term, and that will determine some of the key steps in SEND practice as we go forward. The elements in that space will be vitally important for the place board to have a good insight into, because it's likely that there will be some seismic changes in that space. I'm happy to pause there and answer any questions. I do recognise I've rushed through quite a lot of detailed information against quite a wide breadth of information.
No, thanks Nathan, thanks Gordon for doing the slides. So Nathan, what we'll do is we'll just open it up for comments and questions. So Councillor Roach, your hand's up.
Yeah, I'm a bit concerned about one of the comments on the penultimate slide about the GSNA. I mean, I've heard rumours, but it's never been confirmed that there's a separate children's GSNA. We'd be interested to find out a bit more about that. But a bland comment that says the GSNA doesn't really cover adequately health and care needs. That's the whole purpose of the overall council GSNA. And that, if that is the one GSNA that you're getting at, then nothing's been said to the Health and Wellbeing Board about issues with that GSNA. So I think the slide ought to make it either clear it's about a children's GSNA, and or if there is such a thing, which is I've heard rumours there are, then it ought to link through to the overall GSNA, which does have an awful lot of detail about health and care needs and social and health inequalities. But to say, if it is the overall GSNA, then I'm a bit concerned that's never been raised with the Health and Wellbeing Board.
Yeah, I'm happy to come back on that.
Nathan, do you want to respond, Nathan?
Yeah, that element, Councillor Roach, was directly lifted from Ofsted's appraisal as part of their local area SEND inspection. So that was their commentary that provides that context. I think from our position within the gift of the local area inspection and the work we've been doing, I think there is a breadth of information. I think from the context of children, young people and adults within SEND, it does feel like it's got a strong education context. And actually there is areas around development spaces, especially directly linked to SEND and that cohort, that it needs to provide a wider level of detail and information to inform some of our planning. So your view in relation to the wider context is absolutely right. There is a great detail, but within that SEND focus, it has over time developed a level of focus which is aligned to education. So it's just expanding that so it feels like it's inclusive needs to the wider SEND cohort.
Just very quickly to come back then, perhaps it should have still been raised with Health and Wellbeing Board and Public Health before it went on this slide. Thank you.
Okay, thanks, Councillor Roach. Thanks, Nathan. So I've just got a bit of feedback. Councillor Roach, just gone to mute. That's better. Thank you. So I've just got Sharon. Do you want to come in there?
Nathan, just in terms of the, obviously there's a real importance to embedding the SEND toolkit in terms of driving quality of practice. What kind of evidence will be presented that will give us confidence that we are embedding the toolkit, and then that's got a direct correlation to the experience of our children and young people in the quality of the plans?
Yeah, there's a number of areas around giving that overview. I think one of the key conduits is that extended workforce, and within an education context, that's the engagement of SENCO schools and multi-academy trusts to make sure that firstly got a full understanding of what a high quality graduated approach looks like. So we're developing our SEND network and SEND support across the school system to make sure that it becomes almost a level of mandatory engagement, and we're evidencing that. We're also looking at key steps in relation to evidence that comes to the SEND panel within the local authority, because any submission to that should have a full overview in relation to a graduated approach. And if not, then rather than push that back to a school or an education setting, we're taking a very supportive mechanism to say, actually, this is the reason and rationale we want to work with you. So we're collecting that data. Also, fundamentally, it links to some of them key measures in relation to inclusion. So we look at fixed term exclusions or permanent exclusions as well. That's one of the key measures if we look at social, emotional, mental health. And I know that the DfE have now changed exclusions to suspensions, so make sure I use the right language in that space. But that's a key element. And also, if we look at our provision mapping in Rotherham, it is making sure that we have an up-to-date SEND needs assessment that looks at key areas of demand, and provision matches that over time. So our SEND sufficiency work would also feed into that as well, Sharon. It's having a profile of provision in the sense of provision in that classic sense of accessing the right education setting, but also the school having an evidence base that they've got a SEND provision map in the school. So at each stage of escalation or development of need, that there's the right support in place. So it's a holistic approach, trying to make sure there's key measures in relation to some of the drivers we can see, and then there's also the practice and CPD element around supporting the system to evidence that.
You're on mute, Chair.
Thank you, Gordon. Someone had to do it. So in terms of today's business then, Nathan, you've updated us on where we are with anything. Is there anything in terms of business that we need to do today other than the update? And obviously you've had some feedback.
No, just appreciative of everybody's support in that period as we developed the written statement of action. I do recognise that that was very much a moving element, and it needed strong level of oversight against a distinct timescale. So just appreciation of that. At this point, there's nothing further, Chair.
And thanks, Nathan, for all your work on this. Obviously, very detailed presentation and obviously a lot of work going on. So thanks again. So thanks, Nathan. So what we'll do is we'll move on to our next update. I'm just going to Ian's just had to drop off. So Michael, are you all right just to move on to the urgent and community care update? I think Steph's joining you for this, isn't she?
Yeah, thanks, Chris. Steph, thank you for joining us. Steph's just going to run through the slides. I don't know whether we need Gordon to share or be able to, Steph.
I'll just bring it up.
Thank you.
Everybody see that? Yeah, lovely. Thank you. Okay, so just by way of introduction, today we're focusing on the front door. The front door project is actually a cluster of projects within it. So they're all focused on reducing avoidable admissions and conveyances to the UECC, as well as facilitating discharge home. And the projects we've got at the moment in this cluster is the urgent community response, which we looked at last time, the ICAS project, which we're looking at today, and then anticipatory care, which we'll look at in the future, which is aligned, all of these are aligned to national requirements. And part of the anticipatory care is virtual wards, which we've started work on, so I will touch on that today. So the one we're focusing on mostly today is the integrated community clinical assessment services, which is a bit of a mouthful, so we shortened it to ICAS, so you'll understand why we call it front door most of the time. So this project is building on our current care coordination centre, which is part of TRT services based at Woodside, but also working very closely with our MBC's first contact points, and the various urgent response teams that we've got working across the borough. And the aim of this is to develop an integrated MDT for admission avoidance and discharge home. And what we really want to focus on is making sure that our residents receive the right level of care at the right time and in the right place according to their own individual needs and national standards. So the best way of explaining this is diagrammatically. So when people need urgent support, if it's not emergency, then they, at the moment, our clinicians and particularly our GPs contact the care coordination centre, who screen the call, and we've got qualified nurses who triage. As part of this project, what we want to do is to extend that triage service, so it's underpinned by an integrated multidisciplinary community hub. So what we're looking at in phase 1 is reinforcing the nursing skills with advanced nurse practitioners, but also having in the hub therapy, reablement, and a link worker representing the voluntary sector, so we can really tie in closely with people who do need support, but not necessarily statutory support. And this triage service will work as an integrated MDT to particularly focus on complex cases and make sure that people get the right type of support, and then they'll be allocated to unplanned teams. So that's phase 1. In phase 2 of the project, we're looking to expand the services. So at the moment, we're mostly focusing on the medical pathways, but the scope to widen that and include other pathways into and out of the hospital, particularly relating to surgery. We've also got the potential to actually expand the MDT, so the more specialisms we've got within it, or we're closely working with, the better we can triage our services. So we could add all sorts of specialisms in there, some more focused medical support, potentially GP out of hours, paramedics, for example, social workers, for example. We've got a really good pilot going on at the moment with a social worker actually working in our emergency department for avoidable admissions. And we've got some really good early evidence that that's working very well at the moment. So that would be phase 2. In parallel to this, and this is working across phase 1 and phase 2, is the development of virtual wards. So that's caring for people who would normally be admitted and in an acute bed, supporting them at home. And all the national evidence suggests that people have much better outcomes at home because they're in their own environments. They've got less risk of infection, less risk of loss of mobility, so they just do better. So we're looking to develop an acute respiratory infection virtual ward, which builds on the experience we've had in our COVID ward, and also a frailty ward. So we've recruited a clinical lead for this piece of work, and we've also got project manager in post. And the additional resources, including the clinical and professional resources, are being funded by national Ageing Well monies and funding that's coming on stream in 2022, 23 and the following year for the establishment of virtual wards. So in terms of things that what we're worried about, as is the case in all the place projects that we're doing at the moment, the ongoing system pressures are a real challenge. Freeing up people to have the headspace to design and develop the work and implement new ways of working. And also the recruitment challenges across health and particularly social care is impacting on, on filling vacancies and particularly new posts. Acuity levels, as we do more to deflect avoidable admissions from hospital, the higher the levels of acuity within the community. So it's really important to make sure that we've got safe staffing levels and that we're monitoring people effectively. So that really determines the pace of change that we can go at. As with any cross-organisational change, the logistics of working across health and care is always challenging. There's cultural differences. Often we talk different languages, there are different perspectives, and of course we have different statutory accountabilities. Co-location's challenging, just trying to get each other's IT systems and phone systems talking to each other can be difficult. And we absolutely have to have shared information to make sure that we have a full 360 picture of all our patients and who's working with them. And funding, who pays, is also an issue. But the work that's happening nationally and locally to work together is really helping, particularly as highlighted in the white paper. And of course, the national development funding always helps, particularly with pump priming. So in terms of what needs to happen next, in the ICAS project, we're well into the work on phase 1. As we talked about last time, we're working really closely with 111 to align their directory services with both health and social care. So that really helps with self-referrals into our services because 111 will use this directory of services to make sure they link into the right points of our service. So this more MDT community hub approach will really help with that. We're developing new urgent pathways to help support admission avoidance. We're co-locating reablements, and we're hoping to get that sorted by the end of this month. And we're in the process of recruiting the link workers, so we're hoping that they'll come on stream shortly. And in terms of workforce development, we're doing some really interesting work at place with that. In relation to this project, we're particularly looking at an integrated health and care support worker role. And what we're looking to do is to recruit a pool of support workers that will work in the community hub, and they can be allocated across health or care according to the needs of the individual and the service demands at the time. So it gives us a really flexible and responsive resource. The benefits of that to the individual, to people we're recruiting, is it's a more attractive offer. And they've got the opportunity of career progression, which they can choose to either specialise in health or in care. And the benefit to the system is hopefully it'll attract more people. And it means we're recruiting together for the benefit of Rotherham, rather than sometimes competing to get people into health or into care. In terms of the virtual ward, we're developing the acute respiratory ward at the moment. We've got a draft pathway, which will be clinically approved. And then we're also in parallel to that looking at procuring remote monitoring equipment. So if someone's on an acute ward, they get regular obs done and various tests throughout the day and night. And we need to be able to safely replicate that in somebody's own home. So there's lots of models on the market that are well tested across the system. So we're assessing those for our needs at the moment. And for those who can't self-monitor, this is where the support workers will really help, because they'll be able to go into people's home and contribute to the monitoring process. So we're hoping to do a soft launch in the first half of 22-23, but as I mentioned earlier, making sure that we can manage the acuity levels is really important to that, and procuring and piloting and monitoring equipment will be absolutely fundamental, so that will dictate the pace of change. Nationally, we're required to have on stream something like 40 to 50 beds per 100,000 of the population by December 2023. Now that is a guideline. As we develop the work, we'll identify the rationale for how many beds and in what specialist areas that will be developed for Rotherham. So that's something we'll be building on through the coming year and the next year, and we'll be reporting back on. So that's the summary so far. Are there any questions with that?
Thanks, Steph. Michael, is there anything you want to say before we open it up for comments and questions?
No, then thanks, Steph. I think that was really, really clear. And there's a lot of work going on in that space, and we're clearly getting some traction. I'm really encouraged by it. Thank you.
Thanks, Steph. Thanks, Michael. Any comments from anyone else? Richard?
Hi, so it's really good work. I'm just wondering what discussions you've had, especially with GOTS, in terms of the fact that we're going to continue a sort of centralised visiting service and general practice. That there's lots of additional roles being brought out on PCNs. Just not necessarily the connection between what's happening in primary care but what's happening in your end.
Yeah. GOX is on our delivery group, Richard, and David Clitheroe is our GP lead. I don't know if GOX wants to comment.
So Dr. Mutu, would you like to just comment on the GP involvement in the delivery group?
Yeah, thanks for that. Richard, I'm really sorry, but I couldn't hear your question. Could you just repeat?
It was more a comment, Dr. It was about the fact that we're proposing to continue that centralised visiting service and the centralised services you as a federation are going to provide, and the link between that and this work, and how that going, because it would logically link in with, with the other stuff.
Right. Thanks for that. Yes, as Steph alluded to, both David and myself being in that group, we are there. We have been aware of how things are progressing, and we do know what the challenges are at the moment. So I think the only way to answer to that is we wait and see how this, more than anything, watch this space really. But I think our involvement is definitely there. Thank you.
Thanks, Dr. Mutu and Dr. Cullen. Steph, anything else you want to say before we wrap up? So
No,
in terms,
thank you.
so lots of positive feedback, some great progress.
Chris,
In terms of,
sorry, Chris, can I just add,
yeah.
just on the virtual ward, just to clarify on that, a ward, a lot of people think a ward is where people are very ill. These virtual wards are basically for people who are, you know, okay, and are able to look after themselves at home. It's not a ward, so much, just for clarity that it's not like a typical hospital ward, it's their home, and people who can be managed at home. Thank you.
Yeah, thanks, Dr. Mutu. It is sometimes a misunderstood phrase, isn't it, a virtual ward? Because everyone thinks of a hospital ward, but it's managing people in their own home who would otherwise been in hospital, isn't it, Dr. Mutu? So, yeah, that it's a very commonly used term, but not always understood, isn't it? So, thanks for that. Anything else on that before we go? I'm going to have to. Ian's had to drop off. So what I'm suggesting we do is we defer the mental health agenda item to the next agenda, Wendy. So if you could just defer that to next time. And then Gordon, can you take the enabling group update from comms and engagement?
Yeah, thanks, Chris. This is the latest in the series of the enabler group updates and the communication engagement enabler group. We, during the pandemic, I think just wanted to acknowledge, first of all, that the joint work and the coordination of all the communications across the COVID requirements, from accessing services to advising residents and patients on how to kind of behave, but also the vaccination program. I think just an acknowledgement to the way that we work as communication engagement professionals across Rotherham, and the way that we kind of worked to get those messages out to the right people, working with the voluntary sector to ensure that there was. So I just wanted to acknowledge that, and throughout kind of the last year or two, we've met fortnightly, focusing a lot on the COVID and the vaccination element of it, and I think just on the back of that, really, just the way we've adapted, the adaptability with people being in their homes and having to find different ways to the traditional ways that we've always communicated and engaged with people, working closely with our voluntary sector partners, but also much more digitally focused than the way we communicate or have communicated with people more recently. Moving more to the present, we have returned to our monthly meetings and we've changed the focus. We've taken the COVID and the vaccination stuff offline now from our core meetings. Not saying that it's not important, but recognizing that there's lots of work that we need to kind of get back to and get on with. So we've now moved back to our monthly meetings and changed the focus back to more on our place working, how we can enable the work of the transformation groups and our other enabler groups. One of the key successes that we've had is our mental health campaigns. We launched the Rotherham platform to support residents and clinicians right at the start of the pandemic, and that working built on insights from residents, but also we're working with different areas of the population and also different partners to kind of continue to develop that. And then we're working closely together on the next phase of the Be the One campaign for suicide prevention, and then we've done quite a lot of work over the winter period on anxiety, sharing those messages throughout the partnership, again working really well as a partnership. Mental health will remain a focus. I think we all recognise that mental health kind of come to the fore now in in terms of how people are experiencing COVID, but also getting back to life. We get a lot of feedback that people fears and anxieties of getting back to kind of normal life now that the rules and regulations have been lifted. So we will continue to focus as a partnership on providing support and campaigns around mental health. Just an acknowledgement that we're working really well, really closely with our fellow enabler groups, mainly around digital inclusion, and working very closely with Ben Anderson and the prevention group around some of the work we can do around behaviour change and insights to support the delivery of their strategy and action plan. And that'll be a key feature of the communication strategy as we move forward and how we communicate and engage with people. And then again, system pressures. I think it's just worth acknowledging that we've worked really closely across during a busy COVID and a busy winter period to get clear messages out to the public. So I think to summarize what's worked well, we've worked really well, and I think the partnership working's really come to the fore in that. What are we worried about? There has been some recent changes within our different teams across the organisations, and I think we're now starting to get that stability back again. So the composition of the group, we're just reviewing our terms of reference as a group to make sure we've got the capacity and the right people in the meetings, and we're doing that across the partnership to make sure that both the communication and the engagement, presence and input into the group is at the level that we need. One concern that we've talked about is the fatigue with health messages. They've had it constantly now as a public for 2 years, mainly around COVID, obviously, but people are getting a bit tired with kind of some of the health messages, and there's a shift in focus around people's priorities around fuel poverty and other wider determinants that we need to consider, and how we engage and communicate with people needs to be carefully considered in the wider context. I think what we are finding difficult, and what we will experience, is how we shift our focus back to place priorities to kind of reignite the place plan work while still trying to kind of manage our messages around COVID. It's not gone. We still need to be able to behave in certain ways, and then live the extension of living with the virus and how we communicate with people. What I would say is that over the last year, the way we communicate and engage with people has completely changed, and it probably will change going forward as well. A lot more access via digital means, and working with our digital colleagues to see how we can work on that element of it. So what needs to happen next? Just before the pandemic hit, we had a communication engagement strategy that was ready to come to the board, and then obviously that got thrown up in the air with the pandemic hitting. So the next step is to kind of revisit that plan, update it, refresh it, and then bring it through the governance system. One thing that we need, two things we need to do really, is align it to the changes that are happening in the wider system. Currently an engagement strategy being developed for the Integrated Care Board, and obviously that'll be used across the system, so we need to make sure we're aligned to that. And also we need to define what our priorities are. We've got some priorities at the moment, but we need to just double check that they are aligned to what the transformation priorities are in order to enable the work to take place. Again, we need to engage with our staff across the partners and the public around what the changes are that are happening and what is coming up around the South Yorkshire system, and the move to the legislation that will take place in the coming months. The key focus of the work is around how do we support transformation and some of the updates that we get at this group, but also the enabler groups and the work that they're doing moving forward. Accessing services and mental health will remain a focus, but also on a key priority really needs to be the activity around the elective recovery plan, and how we, as a communication engagement team, support that, but also provide support to those that are on the waiting list at the moment, and how we can and provide regular information, updates, and assurances to them. One thing that we need to do, and I think it's been raised with me a couple of times, is how we celebrate our success and achievements, and how we raise the profile of the good work that we're clearly doing in Rotherham. And the way I want to do that is through case studies, through awards, and I've had a couple of conversations about awards that we may go for in the coming months. And finally, I think in the world where we're moving into digital communications, I think we need to just up our game really on the place-based partnership digital presence. So ICP, web presence, and digital presence, so that we can up our communication, whether that's social media, looking at social media, looking at videos, etc. across the place, but ensuring as a partnership we've got some kind of digital presence. I'll take any questions, Chair.
Thanks, Gordon. Any questions or comments for Gordon? So it must have been a super comprehensive, clear presentation, Gordon, mustn't it? So thanks for that update, Gordon. Lots going on. I think we are there's a complexity in our, as we move from, obviously we're moving from clinical commissioning groups to a South Yorkshire Integrated Care Board, and it's how do we interact with our Rotherham messages with South Yorkshire messages. Done well, they'll be entirely complementary and we'll get best of both worlds, won't they? So we just need to make sure we keep that relationship strong. Okay, thanks everybody. So I think we're now on to the action log and minutes from last time. So Lydia, would you be able to help me with the action log?
Yeah, certainly. So there are two items on the action log. One is around the Place Board receiving an update on the digital place-wide IT services, and this has been delayed a little while, so we're suggesting it might come in May and June time. In May, we're expecting an update on the digital enabling group, so it might be that we can roll it into that. But so that's amber at the moment. The other amber item is around Place Board receiving an overview of the full written statements of action from the SEND inspection, and I guess really it's just a question to Susie whether the presentation today covered that, or if there's anything further we need to receive.
Yeah, thanks. Is it okay if I just respond?
Yes,
Chair?
please,
Yeah.
Susie.
Yeah, I think we've had the last two presentations actually cover things off, and today specifically related to items in the 4 areas of written statements of action. So, I mean, I think it's covered off, but I'm quite happy for me and Ian to bring something, whether you want to have a look at the governance aspects or something like that, Chair. I'm happy to pick it up with Ian.
Okay, I'm okay, but Sharon, what's your advice? So we've got Sharon stuck on.
Not used to Zoom. All the buttons are in the wrong place. What were you thinking of, Lydia? Just what's the specific?
No, I was just looking at the action, Sharon. It says to a complete overview of the full written statement of action from the recent SEND inspection.
Yeah.
And so I thought today probably, the past 2 presentations probably covered it, but I was just double checking with members.
I think maybe, Lydia, I think we're getting regular updates. That's good.
Yeah.
I think we might want to probably in 6 months look at the actual written statement and then the progress against it, so that we can compare it directly for assurance. But I think at the moment we need to make sure that people have got the opportunity to really focus on the delivery angle. And maybe if Susie and Ian had a thought about, as the joint chairs of the board working together in the joint leaders, what that session might look like as a kind of more detailed evidence session. But I think we need to do it when the board has got the ability to have really motored on with the actions and not take too much additional evidence that isn't already going to the SEND board, which is the board that has the responsibility. But I'm sure that Ian and Susie can think about what that might look like in about 6 months. Does that make sense, Susie?
Yeah, it does, Sharon. What I can do is I can work with Ian and Lydia, and look at actually when the planned updates are coming anyway, because we've got the planned updates as part of the children and people's priorities. So I can look at that and look at how we time something that's more specific then around those 4 areas in the written statement and time that in. But I think that's helpful, Sharon.
Yeah.
Okay, so can we forward agenda for September then, Wendy, if we put on for an update on the send and progress against the written statement? Thank you.
Lovely, thank you.
So thanks, Lydia. So just that's the action log. On the minutes, I'm not going to go through them page by page. I'll just see if anyone's got any comments on the minutes, please raise now. Okay, I'll assume that everyone's happy they're an accurate record and we'll sign those off formally. So thanks, Wendy. In terms of communication to partners, we've picked up as we've gone along, I think, but if there's anything anyone wants to flag up around communications, I think probably we picked it up in your piece, Gordon, didn't we? Okay. So risks and items for escalation as a result of our discussions today. I don't think there's anything I would particularly flag up unless anyone has any different views. Okay, thank you. So in terms of future agenda items, I should mention our next meeting on Wednesday, the 6th of April. Our ambition is to, we're trying to get back into business as usual following the Omicron wave of the pandemic. So we're now back into a business as usual, and we've stood down the Rotherham Gold Command, but obviously we'll reenact it if the situation requires it. But for now, we've stood it down. So business as usual for us means meeting face to face. So we're going to have an ambition to try and meet face to face from April onwards. But we recognise that meeting digitally and the access that gives to people who wish to view our meeting is obviously enhanced availability. So what we're going to try and do is record the meeting digitally and meet face to face. So that's our ambition going forward, to be as open and transparent and accessible as possible. So we'll have a go. Gordon, you've been set the challenge of trying to work out the logistics of that, haven't you? So obviously we'll communicate that out when we've worked it out. In terms of our agenda for next time, if we can take the mental health item which we deferred today, please. We've got a review of the IC development plan, and we've also got a review of the IT services report and the transformation group update. Are they still okay? Richard, is the IT services report something you've been involved with?
We're picking up, we're just absolutely bottom it to make sure we can bring it next time. That shouldn't be a problem.
I think it's down for May or June, but we could take it next time if it's ready. And is there anything else anyone would wish to see on our agenda? I think we've got some, in terms of integrated care and the formation of the South Yorkshire Integrated Care Board. I'll perhaps have a discuss with Sharon Chair about whether there's any updates we can bring to board next time as well on that. So Wendy, if we can put an agenda item for ICS, South Yorkshire ICS development. Otherwise,
Chair.
Hello, yeah.
Sorry, it's Lydia. I can't see to raise my hand. There's also the Prevention and Health Inequalities Action Plan and strategy to bring over from the confidential session.
Thank you. So Ben Anderson, our Director of Public Health, will be bringing that agenda item as well, which will talk about our progress on population health management in Rotherham. Okay, that's great. Thank you, Lydia. So is everyone happy with that as our agenda for next time? If anyone thinks of anything, wishes anything to be on the agenda, please contact myself or Sharon and we'll do our best to get it on the agenda. Otherwise, I shall finish our meeting there. And anyway, if any members of the public have any questions for us, please don't hesitate to contact us and we'll either respond directly or put them on our agendas for next time to respond in public. Okay, thank you, everyone.